Hi there. This is a video about our pathology system, in particular the HbA1c part of the system, and aimed really at those of you who might be regularly reviewing individual patients to look at their diabetic control. So more often than not, nurses and diabetic nurses. So we need to start by navigating to clinical reporting, and it won't go there for you straight away, but if you come to reports from Wellbe Innovate Pathology, HbA1c. Now, there's a lot of reports here, most of which you won't need. You might want to consider adding the ones you will need to your favorites. So these will be the key ones. And if you want, you can select them, use this recycling icon, it looks like to me, and that'll add them into your favorites. That means then they're up here, and you don't need to hunt for them every time you're looking. In terms of the way the reports are structured, the top section is the ones you're interested in, which is looking at individual patients. Further down, there's sort of stuff for admin staff to do, and then bulk processes such as bulk coding patients with NDH, or informing them that their HbA1c is normal, or their diabetes is well controlled, all those sorts of things. Those can be largely automated, and certainly not something that generally a nurse needs to spend their time doing. Looking then at these reports, they're broken into two sections. You've got a diagnosis section and then a reviewing diabetes section. Top one is the most important. These are patients who should now be coded as diabetic. They've had repeat HbA1c of 48 or above and not yet been coded. And for all of these, you would use our pathology template. You can access this up here from this little graph icon. And there's a HbA1c page. Now on this page, this isn't a great example because it's a test patient. I'll show you on a real patient in a minute. But you've got kind of quick actions here to record either diabetes diagnosis, or it might be that you've reviewed it and there's a particular reason why it's not diabetes. So you can code that they've been excluded. That will take them out of the report until they have a repeat bloods in a diabetic range. Same with NDH. New episode, or you can record that it's excluded. As well as the main report to review, there's patients who may have had one raised HbA1c that's over 55, not yet been repeated or excluded. That's just there because it may be that actually off the one result, perhaps with symptoms as well, you can record that they are diabetic. Next, there are reports to potentially code patient as in remission, or they might be coded as in remission, but now their HbA1c is over 48. Probably more significantly, there's this report, patients who look like they might have NDH but can't be bulk coded. For example, say they're on steroids, the system would exclude them from being bulk coded, and you need to manually review those. Final one for diagnosis, you've got recent new diagnoses with no diabetes education referral. That might be because they've been coded, but no one's actually told them, or they might not have had their first appointment, or they might have had it and not been referred. The next section then is about reviewing patients who are diabetic and looking at their HbA1c. The system doesn't really care whether they had the HbA1c due to an annual review or 6 monthly or whatever reason. It's basically just hunting for who are the patients who need their meds and their monitoring and so on looked at. So the first one is poorly controlled. The HbA1c is not on target. If a patient has a target code in the last 2 years, the system will work to that target. If they haven't, it will work to the QOF targets. And again, on that template, you can see, let me show you. So it shows you here the target's less than 59. You can code a personalized target here if you want to. And the system will then kind of work to that target for that patient, both in terms of whether you need to review them and also what the patient is told. There's also risk of hypos. Fewer patients, but often missed when results are just filed kind of normally because people may not consider that. Perhaps less significant, there's patients where you might want to consider starting them on an SGLT2 based on recent results. That may or may not be within your remit, but if it is, that's well worth looking at. And then these are patients who have a target of 75 because they've been coded as moderately or severely frail. So they're not in other reports to review, but their HbA1c is still on the higher side. So from a QoF point of view, those patients are fine, but you may decide you want to review those. I think it depends quite a lot on how much you trust your coding about patients who are moderately severely frail. I'm just going to pause the video there and on a real patient show you a bit more what that template looks like and how you might use that. So this is the pathology overview template, HbA1c page for a particular patient. And this is really just to give you an idea of the way the information is presented and the sorts of options you've got. So at the top, you can see that it's awaiting clinician review because the HbA1c is over target. You can see the patient's target and the last 5. You've got other results that might be useful, particularly when thinking about medication changes. You can see when they were first diagnosed, what medication they're on, when they last had a diabetic review. If you want, you can expand that to see more details, and you can see recent bloods. On the right-hand side, then we're looking more at this reviewed section. So these options here will take them out of this report. So you've got a medication review or just a generic review code. You could say no further action needed. So it might be that actually, trying to think of an example, you've recently started them on a new medication, the HbA1c is heading down, nothing more is needed at the moment. Or it might be that you want to arrange some follow-up. That would both add a code so the system knows you've reviewed it and generate a task to say, please book some follow-up. Follow-up arranged is to say you've got an appointment booked already. And then there's a few other options like for SGLT2s, if you're looking at that. Equally, it might be that you've either referred them to the DSN or they're under the care of the DSN. So you can update that here. Again, that would remove them from your reports to review. If there's other stuff you think that'd be really useful to have in this screen, do let us know. We can add that on. It is quite a different way of working. 2 main things to consider, I suppose. Some nurses just work from the list and might even call the patient there and then. Others will say, no, I want to have an appointment. That's fine. If you really don't get on with this way of working, and not everyone does, another option is to say, look, if they're in these reports, then they need a review with you anyway, and the system can be configured to arrange telephone reviews instead. But you may well find going through these that actually not everyone needs a conversation. And it may also be that you can text the patient or say, this is what you need to do, or good progress, or whatever it might be. Anyway, hope that helps, and let us know if anything you think should be changed. Thanks.